I'm Jeffrey Mangel. I'm a urogynecologist and I work at the MetroHealth system. When I was going through medical school, I was actually attracted to both OB/GYN and pediatrics, interestingly enough. I worked with children growing up, and so I was surprised to see how much I enjoyed the atmosphere in labor and delivery, and delivering babies, sort of the excitement of that, the joy of like new childbearing and so on. And then what really took me by surprise was how much I enjoyed operating, how much I enjoyed being in the OR, being a surgeon, understanding the complexities of fixing difficult problems. And so OB/GYN offered, again, a really good mixture of both medicine and surgery, taking care of a wide age range of patients, generally healthy women who are looking for help or a solution to a problem. And so as I went further on through my training, the surgical aspect became so much more compelling and interesting. That's maybe decided to then follow up and do further training in urogynecology, a surgical subspecialty, and ironically enough, move away somewhat from delivering babies, which is what brought me there in the first place. So it's really a fascinating field, and so I enjoy what I do every day. There is nothing more satisfying than someone coming into you with a problem, especially a problem they've had for a long time, a problem that perhaps they've been putting up with for a long time privately, or suffering somewhat in silence with, let's say, bladder control problems or something like that. Finally getting up the courage to come in and seek attention for it, allowing me to evaluate her and see what might help. Then perhaps going ahead and doing a relatively simple outpatient surgery to help treat her primary problem, and her coming back to see me a few weeks after surgery and saying, "I cannot tell you how much this has changed my life. This is unbelievable. I should have met you years ago. Thank you so much for giving my life back." I cannot tell you how good that feels. I came to Cleveland to work at MetroHealth. I'm not from here originally. I didn't have any horse in the fight in terms of which organization, which place in Cleveland I was loyal to. And I cannot tell you how much I enjoy working at this hospital. The people that work here, my colleagues, the other doctors, are they're so committed to providing the highest possible care to everyone who lives here and comes to see us, regardless of their background. To me, it feels very Canadian. We don't triage based on whether they can pay or they can't, where their background is. Everybody here deserves respect and the highest quality care we can offer, and everyone who works here believes that. There's something incredibly comforting and community feeling about that. It's not just a place to work. And so I feel that I would trust these individuals with my own care and the care of my family. Sometimes, I don't think it's shocking. They're surprised to learn I'm Canadian sometimes. And I'm not shy about where I come from, and I'm very proud to be Canadian. So sometimes they're surprised by that. They're surprised when I start speaking to them in French if they have a French background, because I speak fluent French. I love sports, and so from the time I was young, I played hockey and softball, and I like going to the gym and exercising when I have time. As my kids have gotten older, they have consumed a great deal of my free time. So both my boys are avid hockey players, my daughter's involved in school sports also, and so we spend a lot of time with them and their activities. And so I look forward to the weekends because that's my family time, and but a lot of that time is spent now with kids being 15, 13, and 10, going to their activities, and it's fun. Actually, time goes by very quick, as you know.